1 o'clock.
Do we have any replacements?
I don't think so. It being 1 o'clock, we'll call the Finance Committee meeting to order. The first item on the agenda is a hearing on House Bill 619, and I'll call upon the sponsor, Representative Abel.
Thank you very much, Mr. Chair, and members of the committee. For the record, my name is Karen Ebel. I represent Merrimack District 7, which is New London and Newbury, and I'm also here in my capacity as chair of the state stakeholder group, the Solid Waste Working Group. So this bill supports the appropriation of $1 million into the Solid Waste Management Fund. You may recall in the last budget, the legislature saw fit to fund this program. The House actually supported putting $2 million into the fund. Ultimately, it was cut to $1 million, which is where it stands. And it's a matching grant program for municipalities and for businesses to do work in waste diversion. The other thing that we did in the last budget was to revise the language so that 50% of the appropriation would be prioritized for food waste diversion. So one thing there's several things that we can talk about, but a couple of years ago, we did adopt, after a 20-year hiatus, a new solid waste management plan. And as a state, we also adopted new solid waste diversion goals. We're trying to do 25% by weight diversion of solid waste into landfills by 2030 and 45% by 2050. So food waste, and one of the reasons that we prioritized it in the last budget is it constitutes between 25 and 30% of all weight that goes into landfills. Now, we all know that landfills are a big topic around here, and a new landfill isn't a popular prospect with either the governor or vast numbers of our citizens. And we also know that DES has said that from a regional standpoint, there may be a lack of capacity, but there certainly isn't one in New Hampshire. So we should try to continue to preserve our landfill capacity through waste diversion, and that's one of the things that this fund would help promote. So as I noted, our towns are really struggling with trying to keep up with all the challenges presented by waste management. It can be expensive, and helping towns and cities through this grant program is a great way to kickstart food waste diversion and other recycling activities, and it'll help to promote our planned goals. It also is a business promoter, because there's a lot of businesses that from local farms, and I think you all did get some testimony from a local farmer who is trying to help with compost. It's a great source of income to them, and they can turn it into arable soil. So our local farms are interested in assistance. There are smaller food waste collectors and composters. And then we can also try to help to get food to food banks and companies that have anaerobic digesters. So I guess that is sort of a summary. I wanted to say it's interesting. New London, actually, my town, did have a composting program. They started about a year and a half ago, and I got the numbers from them. And if you can believe it, 172 families participated in the program, and we diverted 32 tons of food waste from the landfill in 2024. So that helps with tipping fees. That also helps with trucking. I was talking to the Public Works guy this morning. It's like $700 a load to take all the trash up there. And I guess the one last thing I would say is that we know from all our discussions about PFAS last time, landfills, not only do they sit there pretty much forever, but they also kick off a lot of leachate, hundreds of millions of gallons. Leachate contains PFAS and any number of other terrible substances. So the less that we can put into landfills, it's all good. I think that's it. So I'd be happy to answer any questions about the fund. I know that there's a lot of people in the state that are excited about the prospect of getting some grant funding. I think, I don't want to speak for the department, but the department is certainly interested in helping with waste diversion. And it's really important for our state to do that. So I'd be happy to take any questions.
Thank you. Any questions from the committee? Representative Leishman.
Thank you, Mr. Chairman. Good afternoon, Representative Evil. So I was just quickly scanning your letter that you gave us this afternoon, and I see that our tonnage rates, or the charges that are being charged to the haulers, are pretty minimal, I guess, for the state of New Hampshire versus if you look at Rhode Island and Connecticut, Vermont. And you mentioned that you're looking for about $1 million. Are there other creative ways to raise money, like having a tipping fee, for instance, at these facilities where the state would get, $5 or $10 per ton, or would that work?
Sure. Well, thank you for the question, Representative Leishman. We actually, I chaired a study committee about 5 years ago, and we talked quite a bit about this, and we talked about about funding issues, and we all know with diminished general funds, we do have to be more creative about things. I think I should just say at the start, so people understand, we have about 2 million tons of trash that goes into landfills every year, and about half of that is from out of state. So, and a huge portion of that is from Massachusetts. So, we hear a lot about not massing up New Hampshire. Well, that's one way of massing up New Hampshire right there. And of course, when you have the landfills, it really is a forever kind of problem. Once it's here, it's here. And many states, in fact, I would say a good majority of states actually have a surcharge that they add on to tipping fees. So like if somebody pays $60 a ton to deposit a ton of landfill, to put a ton into a landfill, there could be $1 surcharge on that. There could be a $2 surcharge on that. And that surcharge in many states is actually used to help fund recycling efforts. Really, the Solid Waste Management Fund idea was not my creation. That is actually something that's used in many, many states, and it's used by these surcharges. I did, or it's funded by these surcharges. I did give you some information in the testimony. We don't charge a surcharge, and we rely on general funds for our solid waste activities. And I looked at other states just recently. Iowa actually charges $4.25 a ton, and it's been doing that since the 80s. North Carolina charges $2. Ohio charges $4.75, and Vermont has charged $6 a ton since the dawn of time. So, or maybe a little less than that. So just as a general matter, if you think about it, and if we want to do good work with our solid waste, if we don't want to have more landfills, if we think that out-of-state trash should maybe contribute to some of the issues that we have here by having their trash, then one alternative to funding a fund like this is to at least talk about or consider this idea of a surcharge. And I'd be happy to talk to the division more about that. I I do want to say that in 2021, we had a report, the average cost per ton for municipal waste in Massachusetts to landfill is $122. In Vermont, the average was 116. In Rhode Island, it was 100, and New Hampshire is 60 to 80. So even though our costs are much lower than area landfills in the Northeast region, it's lower, and plus we don't charge a surcharge at all. So I appreciate the question, and I think when you're in a revenue situation like we are, lots of things should be on the table, and we can be creative about it.
Representative McGuire for a question, and then Representative Cambrils.
Thank you, Mr. Chairman. How many tons per year are we talking about here?
Well, I just happen to have the statistic. The best information that we have is 1,923,000 total coming into the total in the state, 1.1 million in state, and we had about 825,000 out of state in tonnage. And that was as of the biennial report that was prepared by the department for, as I say, for 2022. I did double check with the department actually an hour ago to see if we had more updated numbers, and they thought that it was about the same. The out of state may have dropped just a little bit, but that's basically the number. So if you think about it, depending on the surcharge, you could generate a considerable amount of money. And as I say, that's the way an awful lot of states handle this.
Thank you.
Representative Cambrils for a question.
Thank you, Mr. Chair, and thank you, Representative, for taking the question. Currently, how much money is in the fund, and to date, has any of the money been used to start the initiative?
Thank you for the question, Representative. Director Wimsatt is here, but I will say, unfortunately, due to processing time through the personnel department, they weren't able to get the position listed really promptly. And so they're still in the rulemaking process for the grant program. They hope to have that done in the next several months, and then they can start working on the grant. I think, though, that the amount of money that's in it is about $900,000 because part of the money was used to defray the employee. Yep.
Representative Edwards for a question.
Thank you, Mr. Chair. I have a question on both ends of the middle of this. The first one is I'm trying to understand what is going to be expected of families. And I assume this isn't just commercial food because 172 families were involved. Is a family expected to take any food waste that they have, dump it into a special container, keep the container segregated like we used to with aluminum cans, and then take the food waste in that canister and dump it into something at the dump? What does that process look like inside a family home?
Okay. Well, I remember doing it with my German parents when I was growing up here. My mother always had a separate thing just for garbage, for food waste, and that's the way it is now. So I just want to make sure from your question, there's no requirement that people do this in New London. It's an optional thing, and that's the way it is in most towns. So, yeah, I mean, I participate in the program. The town provided a bucket, 5-gallon bucket. I just have it there in my kitchen, not too close to where I cook, and I fill it up. And when it's full, I just take it over to the transfer station. We've got totes there, big totes. You dump the food waste in there. And then once a week, a small growing compost company called Renewal Compost comes up and picks it up and takes it to a farm near your area, Mr. Chair, I'm forgetting the name of it, and they compost it. So that's what it looks like for a family. And, part of the startup fee in New London, for instance, is they bought the buckets that they gave to people.
All right. May I have a
Further
follow-up?
question?
Okay, so my dogs are my recycle system. So they also wash my plates before I put them into the dishwasher, just to gross everyone out. But on the back end of this, it sounds like there is an example of compost companies, and I'm just wondering why we aren't converting those contracts into money to pay for this program. This waste does have some value to it, and I just want to know if we've thought through what the state needs to do in order to recognize the revenue that could be associated with selling that waste.
I think for the most part, they're just farmers and they're using it to augment their soil. I mean, I don't think anybody is making mega bucks on this. I think, and then for an anaerobic digester, it's a waste to energy thing. I'm not sure. I think that you would find that there's not a whole lot of money to be raised there. It would make more sense that we consider $1 or $2 per ton on the trash that's lingering in our land here, mountains, hills, and dales forever.
Thank you.
Further questions from committee members? Representative Ryan.
Thank you very much, Mr. Chair, and thank you, Representative Ebel. So following on Representative Edwards' line of questioning, the savings would really lie with the municipality because they would be saving the cost of tonnage from the diversion. Is that correct?
That would be the goal, yes.
And follow-up, Mr. Chair? Would there be anything to preclude a municipality from generating revenue, let's say from a food composting? If this, let's say a town gets a grant like this, they're going to save on the diversion, but could they also lower their property taxes by creating a revenue stream of compost that may be produced through a
I
project
mean,
that
it's
was supported?
conceivable that they could. I think in Merrimack you have composting. or you have
We get free
sludge, but
compost.
that's sludge. I mean, I think the bottom line is here not to look at the compost as a revenue generator, but to understand that by diverting the food waste, and also, I mean, this can apply to programs to do better with recycling. The idea is to not be landfilling it, to retain our capacity and to do something better with our trash. I mean, from my standpoint, that's about as Yankee a thing as a person could do.
Further from the committee?
Mr. Chairman, Mayor,
Representative Navalenko.
Rich Nalavenko, Cheshire 9. I have a question. The 900,000, what the estimate of $1 million is based on how much you're going to expend annually, or what period of time is this supposed to cover? I know there are startup costs, which I assume the $900,000 that's currently in the fund goes a long way toward covering. And then there's some estimates of how far you expect $1 million to go in terms of the number of. So what is the $1 million
Well, I mean,
based on?
It was not based on a lot of appropriations for a grant program. You put money into it in the hopes that it's used to do the things you want it to do. But I think it's really difficult to estimate how long $1 million would last. I mean, you could ask the department this question, but I mean, I know in my own town, they needed a new baler so they could bale their aluminum cans, some people, and that way, if they could bale more, they could hold more, and then they could save on shipping because they weren't shipping it all at the same time. I mean, for a compost program, it could cost $500 to get it going. I mean, it kind of depends on what the grant requests are that come in. So I I wouldn't see this as a program where somebody was going to come in and ask for $250,000. At least that's not my conception of it. My conception of it is to help small businesses grow and to help municipalities.
A follow-up question,
Follow-up.
please. So in your town, you said they went out and bought bins, and what was the approximate cost?
don't know.
No idea. Okay.
I mean, it wasn't a lot. It wasn't a lot. But, you know, they took a poll in the town. People were super excited to do composting. The selectmen looked at it. They put some seed money into it. We have a contract. And, you know, as I said, we've already diverted 32 tons of trash in a year, which is kind of amazing.
Well, thank you. Thank you for the answer.
Representative McGuire.
Thank you, Mr. Chairman. Thank you. What fraction of the tonnage is from New Hampshire?
I thought that I had mentioned that number, so I didn't do the exact
this is
calculation,
what
but we've got 1.9, I mean, we've got the LBA here, maybe she can do the number. No, I'm kidding. It's, we have 1.923 million total. We've got 1.1 in-state, and we have 820,000 out of state, but that was 2022. That's the best I can do for you.
Thank you.
There's no further questions. Thank you very much for your testimony. Everybody note that we have a written copy passed out. Next, we'll call on Brody Deshays from the NHMA. Welcome to the Finance Committee.
Thank you, Mr. Chairman, and thank you to the committee for taking my testimony today. My name is Brody Deshays. For the record, I represent the New Hampshire Municipal Association. I'm here today to talk trash with all of you. Sorry, I had to. Yeah, I know. Sorry, guys. So, the goal of this bill is to help municipalities fund the support and the initiatives for local programs that will promote sustainable, efficient, and affordable food and other organic waste disposal. The ultimate goal will be limiting the amount of tonnage of waste disposal that goes through whether it's private or public landfills. Ultimately, these landfills are funded through tipping fees or other fee schedules, and any, if you're in a municipality, any difference in what they can't fund through their fee schedules will ultimately be funded by the property taxpayer. So in many ways, we view this as priming the pump, not just for initial property tax relief for small programs that will create better waste disposal practices, more sustainable waste disposal practices, but ultimately help local governments create better practices that will create cost savings long term down the road. So it's kind of thinking, an ounce of cure today will save a pound of cure tomorrow. Or I should say, an ounce of prevention today prevents a pound of cure tomorrow. There are municipalities that are interested in using these funds. As the representative mentioned, it's taking some time to hire someone to administer to the grant program, which we understand in this labor market that can be difficult. But the interest is certainly there. New London is one example, but there are other municipalities. And we can do a poll of our membership to get more specifics, but we know there are other municipalities that have, not just expressed interest to us, but I assume also expressed interest to some of you on the Finance Committee about this program. So with that, I'll take any questions. I only know so much about the waste disposal practices in our state, so I'm willing to try to answer anything here. And if there's anything I can't, but the committee needs the information, I'll do some research on the back end and get back to you guys.
Thank you. Questions from committee members? Seeing none, thank you very much. We'll next call on Reagan Bissonette, and he has passed out she has passed out a written sheet of her testimony, so you can follow it along. Welcome. Thank you.
Thank you. Thank you, Mr. Chair, members of the committee. My name is Reagan Bissonette. I'm the Executive Director of the Northeast Resource Recovery Association. We are a nonprofit whose membership includes 90% of the communities here in New Hampshire, so most of the communities represented in this room. And we help communities with recycling, composting, and waste reduction. One of the things we do is we actually help communities when they have recycling that is ready to get sent to a company to be recycled. We actually help make that connection. We also provide a lot of education and technical assistance to municipalities to support their programs. And so one of the things we do is work with communities on composting and food waste reduction. And I can share that at our annual conference that we hold each year that brings about 300 people together, mostly from New Hampshire municipalities. Last year at our post-conference survey, the number one topic the communities wanted to learn more about at this year's conference was food waste and composting. And that was a bit of a surprise to us, but I can say that anecdotally, we hear quite a bit from communities that they're interested in ways that they can reduce their food waste and reduce the food waste that we're sending to landfills. So as you heard from Representative Ebel, when we look at the waste that we are disposing of in New Hampshire, we know from national numbers that approximately 24% of that waste coming from municipalities and businesses is actually food waste. So it's a very significant component of the trash that we're disposing of. And in the Northeast, our municipalities are paying more for disposal of trash compared to any other regions in the country, in the continental US. So it's a rather expensive cost for our communities to dispose of their trash. So opportunities to divert food waste provides the potential to reduce costs for our municipalities. Specifically, I wanted to highlight that the city of Lebanon, they started a pilot program to help their residents take their food waste and have it composted on site a few years ago. And what they found is that during that pilot program, the city had about a 30% savings from composting that material on site instead of disposing of it in the landfill that the city operates. Now, our organization put together a map for the entire state of New Hampshire showing all of the municipalities that we're aware of that currently offer opportunities to residents to compost or otherwise manage their food waste aside from disposal. And we also have on that map all the businesses, private businesses and farms that we're aware of that provide those services. And right now, in terms of the communities that are participating, it's about less than 24. And in terms of the businesses we're aware of that provide services in New Hampshire for communities to compost or otherwise manage their food waste, it's under 24. So there's maybe 8 farms, maybe 10 businesses. So really there's a real opportunity to increase business opportunities for farms or other private businesses that would like to help communities reduce their food waste and manage their food waste in a different way. Because when you look at that map, there's a lot of big holes right now. So, our organization doesn't take a position on bills as a matter of policy, but I hope that this testimony is helpful to you all as you consider how this bill might impact our communities here in New Hampshire. So I'm happy to answer any questions you might have.
Questions from the committee? Representative Edwards.
Thank you, Mr. Chair, and thank you, Ms. Bissonnette, for taking my question. Because we're a legislature, we end up continuously looking at state-driven solutions. I'm just curious, in your experience or general awareness, has another approach, an alternative, been tried anywhere where an effective public relations effort is put together to share with the public the facts around waste, to encourage at-home composting? Has there been efforts to get individuals involved in solving this problem instead of just going to a collective solution?
Certainly, yes. I mean, both with managing food waste and recycling, individual public education is always an important component of trying to spread that message. I think what's challenging is at the same time expecting individuals to each be managing their own food waste in this instance. It's asking a lot of people. And so it is easier and more convenient for residents if their municipality or, say, a local business is able to offer services for them. Not everyone wants to compost in their backyard. I used to compost in my own backyard, and eventually I was quite lazy about it and didn't turn the pile enough. And eventually, some unpleasant odors came out. And I found that it was easier for me to work with a local business that would haul away my food scraps. But I think it's a lot to expect individuals to go out and seek out those resources on their own. And so one of the benefits of knowing if your community has that opportunity for you and that your residents are participating, it just makes it easier. But yes, absolutely, education is always an important component and, can only have so much success.
Further from the committee, Representative Nevelinka.
Thank you, Mr. Chairman. Thank you, Ms. Bissonnet. It's not on the topic of waste food, but it is on the general topic of solid waste management. Can you tell us, my town recently decided not to recycle plastics. And can you tell us what percentage of plastics actually get recycled?
Yes, thank you for the question. I'm happy to answer that. So there's a lot of confusion around plastics, understandably. Again, public education can only go so far, and there is some misinformation sometimes. So one thing I'd like to start by saying is that if you are recycling plastics or any other material that your town or say your business says can be put in your recycling bin, you can have a very high confidence that that's being recycled. Now, you might have heard a number thrown around that only 6 or 7 or 8% of all plastics are recycled. What that refers to is all the plastic that's ever been produced. So that includes the plastic in this microphone, that includes the plastic on the dashboard of your car, that's all plastics. What that doesn't mean is that only 9 or 6 or 7% of the plastic that you put in your recycling bin is recycled. So I always let people know, recycle what your community says can be accepted, and you can be very confident that that is being recycled.
Thank you.
Further from the committee. Seeing none, we'll next call on Director Wimsatt from
Thank you.
the New Hampshire Department of Environmental Security. What's that?
It's services.
What did I say, services? Security. Thank you for the correction.
Thank you, Mr. Chair. We like to think we provide some security as well. Good afternoon. For the record, my name is Mike Wimsatt. I serve as Director of the Waste Management Division for New Hampshire DES. I'm joined today by Michael Nork, who heads up our Materials Management, Education, and Planning section and is very much engaged on our work to advance food waste diversion. The agency is not taking a position on this bill, but we do want to make ourselves available to the committee for any questions you might have. And I'd just like to make a few remarks, keying off on some of the things that have been said already. Indeed, we're working in earnest on working on rulemaking to establish a grant program for the Solid Waste Management Fund. We anticipate great interest in that grant program on the part of municipalities, because really municipalities, for most people, are kind of where it's at with respect to their household waste management. They either have a municipality that arranges for curbside pickup and disposal of their waste, or they have a municipality that operates a transfer station where they go every week to take their trash and recyclables. So we expect them to be a key recipients of some of the grants that we would expect to make. We also anticipate that private entities and farmers and others who have already established compost programs or who wish to start them will come to this grant program to try to either, if they already have a compost facility, they would try to make some capital investments to advance the amount of capacity that they have to treat compost. And also new startups that want to start. And really, the whole purpose of the food waste ban for the large generators of food waste was to try to incentivize the development of a network of facilities of different types and different technologies that could manage food waste. We also anticipate that one or more anaerobic digester outfits might come in looking for some matching money to advance that technology and provide that service, particularly for that's actually a very good technology that can work really well for single stream types, sort of a very reliable kind of food waste, which might come from a manufacturer or from a grocery store or something like that. And then we also anticipate that some of the entities that are subject to the food waste ban, these are the folks who generate more than a ton per week of food waste, may come to us saying we could use some assistance in developing or capitalizing certain, infrastructure for managing, transitioning from disposing of our food waste in the dumpster to collecting it in some fashion and then transporting it to a facility that can divert it from disposal. So with that, there was also some talk about education, and we certainly, we've been working very hard to advance our website and the amount of outreach that we do. We work very closely with a solid waste working group, as the sponsor has indicated, to look at really advancing our education and outreach. I would note that, the hard part about using solely education or outreach to try to advance a newer way to manage waste is that it's really hard to get more convenient than everything you generate, you just throw in the trash and somebody picks it up and makes it go away. That's really hard to compete with. So that's one of the reasons the food waste ban was implemented, because it is really hard to convince people that there's anything easier than just throwing it away. And because they don't see necessarily the impacts of that, or even necessarily directly the cost impacts, there sometimes need to be some kind of incentivization. The Solid Waste Management Fund, the food waste ban provides sort of incentivization to say, okay, if you're a big generator and you've got access to a facility near you that can handle this in a way that isn't landfill disposal, then we're going to expect you to avail yourself of that kind of service. That's one way to incentivize it. But the other way is to provide these matching grants to help defray the costs of the initial capital costs of developing these facilities. And that's what we envision the grants that we'll be making under this program to really help to accomplish. And with that, I'll just open it to questions.
Representative McGuire.
Thank you, Mr. Chairman. Thank you, Mr. Wimsatt. We heard that the fund currently has $900,000. Is that correct? And when do you expect to make the first grant?
That's right. We're working in earnest on rulemaking. We don't do much without rulemaking first. And so we're working on rulemaking. We expect that to happen over the next several months. And certainly, conservatively speaking, we would expect that by calendar year end, we'd be in a position to start advertising and soliciting grant applications to administer the grant program.
Representative Priest.
Thank you, Mr. Chairman, thank you for taking my question. You mentioned that there was a food waste ban in the state?
That's correct. And that just became effective this month, actually. And essentially for generators of food waste who generate more than 1 ton per week of food waste, if they have access to a facility within 25 miles of their facility that can process that food waste and accept it in a manner other than landfill disposal, then they're banned from disposing of that food waste in a landfill. Now, it has to be said, this is a brand new program. We're really working on education and outreach. We're not out there. We don't have cops out there looking to bust somebody because they disposed of their food waste. We're working right now on doing a food waste study to understand that universe better. And then we'll spend a lot of time trying to get out and educating those folks on how they can comply with the ban.
Okay.
Further.
As a follow-up question, does the Department of Environmental Services have kind of an overreach goal of how much waste they're wanting to divert by what year? And how are we getting closer to that goal?
Sure, great question. We do. We have a legislative directive, actually. There's a goal was established by the legislature to reduce the amount of waste that is disposed of in landfills or incinerators by 25% by the year 2030, and then by 45% by the year 2050. That's what's in the statute right now. And we're working towards that. I have to say the Solid Waste Working Group, which is chaired by this bill's sponsor, has been, meeting monthly really now for a couple of years to really try to advance the kind of policy and programs that will help us achieve that. Ways that we do hope to do that. The food waste ban is actually a great one because it just so happens that at least probably around 25% of the weight of the tonnage of waste that is disposed of in a landfill is identified as likely being organic or food waste. So if we can make significant progress on that piece, that gets us a long way to that goal.
Further.
Okay, one more question. And again, what I've been hearing is that with this food waste recycling that's being proposed and the food waste ban, 25% of the total tonnage could be diverted and could be reused. Is that correct?
I think, you know,
Lowering-
I don't think that the food waste ban alone is going to achieve that. We've got other, you know, work that we're doing. We're trying to advance even simple recycling in terms of, you know, the Solid Waste Management Fund is not just for food waste grants. It's for grants to do for anybody that's going to advance a technology or a facility or provide something that's going to move the needle on reducing the amount of overall waste that we dispose of. So as the chair, as the sponsor of the bill mentioned, if someone comes in and wants a small grant to get a baler because it'll increase the amount of a certain type of plastic or aluminum that they can recycle, that's a great fit. And then we can make a grant for that. They can get that. And you know, anything on the way on up to an anaerobic digestion facility that's going to have, you know, a significant investment of capital that wants some assistance to try to set up something like that for food waste. So it really runs the gamut of the waste types, and we're going to be trying to attack it on all fronts.
Thank you.
Representative Edwards for a question.
Thank you, Mr. Chair. I heard in your testimony that education alone won't move the needle much. At least that's my interpretation of part of your testimony. As somebody who consumes a lot of media, I don't believe I have ever seen a public relations piece encouraging families to take care of their own food waste issues. And so I guess I have a two-part question in here. You know, are you aware of any communities anywhere in the country that have tried to get the public more directly involved in self-sufficiency? And if you thought about it, how much would it cost for us to do a test pilot on a public relations campaign in lieu of grants to build more government infrastructure?
That's a great question, and please don't take my remarks to suggest that education isn't important to us at the department. It very much is, and we spend a lot of time and effort advancing that. I think it's both and really in this case. As far as there certainly our ability in the department to spend a lot of time and resources on outreach has been somewhat limited because for many years our program was very resource deficient, and we have only recently in the last few years gotten a couple of staff that can work full time on this, and they have done some great things. We have a website that's really helpful now that can help instruct people on what they can do with any number of types of waste for recycling and what have you. I'm certainly, I don't have any specific examples, but I'm sure that there are other states that have done exactly what you said, where they have outreach to help people, encourage people to home compost. I'm a longtime home composter. I live in a setting where it makes sense to do that. If I lived here in town, my neighbors might not appreciate it very much, but where I live, I can do it, and it works great. And that, as a first instance, I compost my own food scraps, and it advances my own garden, so it works great for me. But for many people who either aren't interested in that or don't have the setting for it, disposing of food waste in a way that gets it to a facility where it can be composted, even though it's not in their backyard, is still a worthy goal.
Representative Leishman.
Thank you, Mr. Chairman, and nice to see you, Mike. A question on surcharges. Would the department support assessing a surcharge per ton of waste?
I'm not in a position to say what our position would be at this point. I can tell you that is something we have explored over time, over several years. And as you know, it takes a certain set of circumstances where there's support for that, both at the legislative level and at the governor's level. But certainly it's something we're willing to work with the committee on. It's easy math, right? Representative Ebel is absolutely correct. It's about 2 million tons of waste that are disposed of in landfills or in our one waste energy facility each year. And so every dollar of a surcharge would likely raise $2 million. So that, those kinds of revenues could really pay for what currently is a general funded program. For argument's sake, let's say a $2 tipping fee, a surcharge, that could provide $4 million, which would essentially cover all the operating costs of our solid waste program and leave ample funds to make annual grants for advancing waste reduction.
Thank you, Mr. Chairman.
Representative Daniels.
Thank you, Mr. Chairman. How many processing facilities exist in New Hampshire?
You mean processing for food waste?
Yes.
I'm not sure I know the answer. Mike might more likely know the answer.
So we currently have 10 operating permitted composting facilities in the state. Those are the facilities that are permitted to accept food waste for composting.
Okay, thank you. Follow up. With the budgets, from what I've seen throughout the state, really tight this year, what makes you think the priorities are going to be given to solid waste reduction as opposed to increasing the quality of the roads and plowing and other things that towns and municipalities need to take care of?
I don't honestly know where the priorities will be. Our job here in the Waste Division is to implement our programs to the best of our ability. It's up to the legislature to decide where the funding priorities will go.
One final. So I guess the root of my question is, if we took this $1 million, what are the chances that people are going to be going after the grants?
Oh, I think
as opposed to the other priorities that they need to take care of, because it is a 50-50 grant.
Sure. We have a very close working relationship with our municipalities. I'll take them as an example because I think they would be kind of our first in line customers for these grants. They work very hard. They're very aware of the costs that are associated with their management of waste. And I wouldn't expect them to necessarily frivolously want to go advance a program that on balance was going to cost them more money than it saved them. But for the reasons I think you heard from the other witnesses, a small investment such as a baler, for example, can often pay for itself quite quickly because of the increased revenues from collecting recyclables. Making small investment in a composting program at the municipal level could save, essentially, Representative Ebel talked about the $60 to $80 a ton rate that was reported to exist in New Hampshire. I actually think those numbers might be a little dated. I'm hearing higher numbers now, and the new contracts that are being executed between municipalities and waste haulers are much closer to the $100 a ton level. So when you think about it that way, if even a small municipality can avoid 10 tons of food waste going into their dumpster and hauled off to the landfill, that's $1,000 savings right there. So I think that there will be great interest in that, and maybe even because we are having tight fiscal times.
Representative Rung.
Thank you, Mr. Chair, and thank you, Mr. Wimsatt. It's nice to see you again. Aside from the savings on property taxes that people spend, to operate a transfer station or a landfill in their town, and also the fact that diverting waste provides a longer lifespan for that landfill, are there any other benefits to keeping food waste out of a landfill?
There are, one of the managing a landfill is a complex activity, and one of the things that makes it complex is that landfills generate landfill gas, which is primarily methane. And the reason that they generate gas is because when you put waste in a landfill, the organic material, like food waste and organic waste, eventually, consume all the oxygen in their degradation. They create an anaerobic environment. And then at that point, all the degradation that happens converts that food waste or other organic waste to methane. And so that methane then needs to be collected, and we work really hard to make sure our landfills have systems for collecting and flaring or burning that gas for energy recovery in some cases. But the reality is that even the best run landfill is going to have some significant fugitive emissions of methane. And methane is a greenhouse gas. It contributes to climate change. So it's anything we can do to reduce the amount of organic loading in our landfills will tend to reduce significantly the amount of methane that's generated by those landfills.
Can I add on to that? That also an issue of concern to the legislature of late has been leachate, and organic waste in landfills contributes to leachate because it contains moisture, and as that organic waste breaks down, it releases that moisture, which then filters out as leachate. So it's another way to look at the benefits of removing food waste from landfills.
Home composting isn't too bad. I've been doing it for 50 years. You do need a shredder. And I've had the same shredder for 30 years. And I break up a big pile of leaves, cover it over with a tarp. 2 or 3 times a week, I take my bucket of garbage and throw in start up the machine, throw in an armful of leaves, throw in the garbage behind it. I separate the meat and the bone scraps, and they disappear from the raccoons and the fox and the crows. And the only problem it's been lately is the turkeys come and tear it apart looking for worms and spread it out more than I'd like. But I've always had a good amount of fertilizer and been doing it for 50 years. Anything else? Representative McGuire.
Thank you, Mr. Chairman. Do you know what the tipping fees and surcharges, if any, are in the state of Maine?
I can't say I know the specific numbers. That question is difficult. Even in New Hampshire, it's hard for me to say because everybody who has a contract with a waste hauler or disposer has their price, and it's market based, based on the amount, it's based on a whole bunch of things. So it's hard to say. My understanding is that those rates are probably in line with what we're seeing in New Hampshire.
If the question was about surcharges that are paid on top of tipping fees, we can get you that information. We have that information for the state of Maine. I just don't have it on hand.
Thank you. And,
If you give it to the LBA, they'll be able to distribute it to
Okay.
us.
and presumably that would give you tonnage and other information because you would know X per ton plus total, you know. So, thank you.
All right, we've got another bill we've got to move on to. The plan is that 619 will go to Division 1, and they will be working on it for execing. I plan an exec session on the bills that have been done through Division 1 for next, what did I say, Tuesday at 1?
10.
Tuesday at 10. Tuesday at 10 o'clock. Next Tuesday at 10 o'clock, we'll have an exec session on probably 4 or 5 bills.
Yeah, I think it'll take 2 minutes because they're all retained, right? So,
Well, we need to be here anyway. All right, we'll close the hearing on House Bill 619. As I say, it's going to Division 1. For further, I have a blue sheet with, only signed by Brody DeShays, but I also have the House Remote Testify Bill has 49 people in support, 3 opposed, 1 neutral. So those will go in the record as well. It seems to be a well-supported bill. And we'll get ready now for next to House Bill 519 from Division 3.
Right, go here, because it's got a non-germane amendment as well.
Yes,
I gotta go to Edmund.
thank you.
I'm gonna take a quick break here.
All right, we'll call upon Representative Edwards. Thank you.
Thank you, Mr. Chair. I'm Representative Jess Edwards, District 31, Auburn, Chester, Candia, and Deerfield. And I want to talk today about a non-germane amendment to HB 519. The Senate, the Speaker approved this as a non-germane amendment. For some background, this committee heard HB 519, referred it to Division 3. Division 3 had testimony on the 28th. That this bill is a good bill. It recognizes Waypoint as a vital service provider for homeless services for 18 to 24-year-olds. It's kind of a unique service in the state. It's something that the governor wanted but didn't get it into the budget. DHHS wanted it but didn't get it in the budget. So Representative Woolner and others did 519. It's, like I said, it's a good bill. On the 28th of January, at the 50-minute and 50-second mark, I made a commitment to the people who run Waypoint that the language of 519 was going to be protected. We were going to move the language of 519 into the budget, but I did not commit to a dollar amount. I just said, you know, we don't know how much money we're going to have, but I'm not going to lose your language. That's on the record from the 28th. So what I'm proposing to do today is to take 519 and take this non-germane amendment and have this non-germane amendment tweaked a little bit so that it becomes a replace all. It's not quite a replace all. Right now, this amendment would become an additional section. And so I'm recommending we replace all with a new section. And this new section is to amend current statute, which is RSA 151, by adding a section that says that the violation of the Patient Bill of Rights, the Department of Health and Human Services shall not contract with any hospital found in violation of any section of RSA 151:21, the Patient's Bill of Rights. So in a way, this is not new policy. The Patient Bill of Rights has been debated and is in statute. The issue gets to be one of helping to encourage our hospitals to comply with the Patient Bill of Rights. There's been a rather spectacular case that we've been made aware of, and so we've had advocates come and ask that we do a little bit more to take the existing policy of the state and try to do what we can to encourage the hospitals to cooperate with our legislative intent to have the Patient Bill of Rights respected. So that's what this non-germane amendment would do. Again, I propose a tweak to it to make it a replace all. Use 519 as the carrier. Have us exec it next week. If we like it enough to send it to the House, I'd like to have the House take a position on it. That's why I want to get it to the House floor so that it's not some finance in the darkness sticking it in. It's a position of the House if we do it that way. I'll take any questions.
Representative Telersky.
Thank you, Mr. Chairman. Thank you, Representative, for taking my question. Can you please share how many hospitals actually contract with the state?
Any that do in the future would be subjected to this law. So regardless of what the number is today, this is a future-oriented bill, and any future contracts with any hospital would need to comply. I think we have on the order of Mr. Bradley is here. I think we have on the order of about 23 hospitals of varying sizes throughout the state, but he can provide a better number than that.
Follow-up?
I think anytime there's a Medicare patient, then half the money is coming from the state. So virtually anybody that has Medicare patients is billing with the state.
I was just trying to determine how many, what it would encompass in terms of the scope of this. So may I just have a follow-up?
Follow up?
Thank you. I appreciate it. I know that the case that you just alluded to and didn't go into detail about, but is there any record of how many violations of the Patient Bill of Rights has occurred? Or is this just an attempt at that one situation that happened very recently?
What was exposed was an anecdotal example of a grotesque failure to respect the Bill of Rights, where potentially life-saving healthcare intervention was being denied because the person refused the COVID shot. It wasn't just an incident. It was an extremely serious and bizarre incident in my view. And it's clearly a violation of the Bill of Rights, where it says vaccine status should not be affected. Now, anecdotally, I've heard that there are other cases that are having similar problems because the offending hospital changed their policy enough to let non-COVID people get services, but any other vaccines that they thought were necessary or mandatory was still the cause for denial of care. And I haven't had an opportunity to corroborate those anecdotal examples beyond the one that made the news that required our speaker to get personally involved and the AG to get personally involved. But what this would do is just make it really clear to everyone involved that the legislature and the governor approved the Patient Bill of Rights, and we did it because we wanted it to be followed. And this isn't a new requirement. It's an existing requirement. Just please comply with the Patient Bill of Rights. In terms of scope, it explicitly limited it to the hospitals and not every healthcare provider. I did that because I appreciate that there is a regulatory burden involved here, and I wanted to do a light touch on the regulatory burden. And so by establishing a beachhead with the hospitals, I hope that it sets an example for other health providers to just voluntarily comply with New Hampshire law.
Thank you. Can I have one last final? Thank you. I appreciate you pointing that out, which was sort of related to my first question on the language of just hospitals. I am concerned, however, on the underlying bill. You and I spoke briefly about it before this hearing. The amendment as drafted, as you said, does keep the original language in there. I am concerned about the waypoint situation and keeping that forward facing to the public. And now you're saying you want to do a complete redraft to remove that section. Don't you think that this might be a better vehicle to go as amendment to House Bill 2? Why do we need to put the waypoint bill in jeopardy?
Well, you got a couple different issues there, and they're both perfectly valid in my view. One, you and I share the emphasis on doing something to help Waypoint. So there's no air between us in terms of making sure that we consider the language that's in 519 and to migrate it into House Bill 2. I've already been instructed the Division 3 LBA to make sure that that happens, and it's one of the things I'm going to follow up on. If we followed typical mechanics, we would be retaining 519 in any case. If we were to retain it, it loses its public visibility. So there isn't really an advantage to keeping it in 519 if we're going to retain 519 anyways, because it loses its public awareness until the beginning of next term. So I think by the beginning of next term, we'll have put this into HB2, we'll have discussed it, we'll have fought very hard to try to find some money for it because it's $500,000 a year in new money. So it's a big ask, but I want us to look for it. So we share the concern about protecting Waypoint in terms of visibility and concern by the legislature. The reason I want to have this non-germane amendment go to the House floor is because I think, well, one, I'm guessing, but I think it'll pass the House. And when it passes the House, then we will have a very clear statement to reinforce the existing public law that the Patient Bill of Rights is important to us. And then therefore it should be important to our healthcare providers.
Thank you, Mr. Chairman.
Thank you, Mr. Chairman. Representative Stringham for Mr. Edwards. The Patient Bill of Rights.
Representative Edwards, I worked hard for that title.
Thank you. Thank you for introducing this amendment. The Patient Bill of Rights is already law and included, as you said, is RSA 151-218. I think you would agree that hospitals are one of the most heavily regulated businesses in the country. They have to comply with countless regulations dealing with public safety, worker safety, finance requirements, HIPAA, Patient Bill of Rights, many, many other things, with the unenviable task of establishing guidelines that often take into account competing priorities of, for example, protecting worker safety and patient safety. I've certainly been to Dartmouth Hospital. I've seen Patient Bill of Rights posted in the elevator before. It sounds like one thing happened to one patient, that there was a disagreement, which is going to happen, which you described as serious. But can you explain why we really should amend a bill that we all support with this issue here that is already covered in RSA 151-21, which I know our hospitals all take seriously, with a non-germane, and by implying that we're going to threaten Dartmouth Hospital or one hospital by taking away their
contracting is voluntary. There's no threat. It's just saying if you want to do business with the state, you'll comply with state law. That's not a threat, is it, Representative? Did you mean to say that?
Well, what I think this implies is, I mean, they are under contract. They're already agreed to apply with the Patient Bill of Rights and all other laws. Would you agree with that?
No. And I apologize for interrupting you.
No.
We're not here to debate. And so the takeaway to me on your question is, you know, I agree hospitals are heavily regulated and have a huge compliance function. As you pointed out, they're already aware of the Patient Bill of Rights if they're posting it in the elevator. So we're not really expecting them to do anything that they're not doing. But I would just point out that in this particular instance, this hospital put a tremendous amount of senior management effort into denying a patient their rights under the Patient Bill of Rights. And so I'm not asking them to do anything but what you're suggesting is to take the Patient Bill of Rights seriously. So I think we're actually in agreement on that.
Thank you very much.
All right.
Further questions from committee? Representative Rung.
Thank you, Mr. Chair. I have a couple questions. Representative, thank you for taking my question. Why did you select this bill specifically to attach a non-germane amendment to?
Great question, because like Willie Sutton said, I rob banks because that's where the money is. This bill was the only bill in Division 3 that I had any control over. So when you only have one option, you exercise that option. So that's why 519 got picked. And because in Division 3, it was universally accepted that we want to take 519's language and put it into HB2. We already had decided that. The utility of HB 19, given that the alternative was to retain it, it had near zero utility as a retained bill. So I'm giving it a reason, a purpose, a repurpose for life.
Okay, follow up. But what value is there in 519 with just the language? Isn't its value in the appropriation?
We would have to debate the money. We're going to have to debate the money in the Division 3 deliberations around the budget. In any case, nothing is different. This, you know, taking 519 as a shell and putting the non-germane amendment in it doesn't change any of the work we're already committed to doing. We're going to take the language, put it into HB2. We're going to go through our budget cycle where we look at all the departments. We're going to look at the fact that they're going to ask us for more money than we have, and we're going to try to find money for Waypoint. All of that's going to happen. 519 is irrelevant at this point.
Okay, and then just one more. In the language in your amendment, Representative, you mentioned that Department of Health and Human Services shall not contract with any hospital found in violation. Does that apply to every single contract that a hospital may have with the state?
I'm not up on every boilerplate piece of language there is on our DHHS contracts, but if you're familiar with contracting, there's typically, a statement of work that comes in and sort of the section C of it where it's unique to that contract. And then there are an endless gob of pages of boilerplate. And I don't know what it goes into the boilerplate, but I think once DHHS adopted this language and stuck it in the boilerplate, there'd be no additional administrative overhead to doing it or maintaining it. Was that your question? I don't think it was.
No, not really.
It was what I wanted to say, though.
Yeah. No, I really wanted to get to the fact that, we're putting every single contract at stake with hospitals, and we don't even know what the extent of those are. And I guess I'm asking, what is the total amount of risk in losing services to the state that we currently contract with hospitals? I mean, if there was, instead of, let's say, going to a hospital and say, you violated the patient bill of rights, you need to reverse the decision, that would be the most straightforward, easiest, least expensive solution to a problem. But I'm wondering, have you done any assessment as to what the exposure is in losing those hospital services if a hospital is found to be in violation?
I don't think we're going to lose services. It's already state law that we have a patient bill of rights. The expectation is already that the hospital should comply. There should be no threat of a discontinuity in a service relationship because it's already in the law. So what was lacking was an efficient enforcement capability that caused there to be sort of this public effort to get some media attention on it, to pull in the Speaker of the House, to pull in the governor, to pull in the AG, all this extraterrestrial, work to get a simple voluntary compliance thing voluntarily complied with. So I do think there's a need for the bill because I think it's valuable for us to restate to the hospitals, not to every healthcare provider, but just to the limited hospitals, that we were serious when we passed the Patient Bill of Rights. We weren't just kidding around. We really expect it.
Before we prolong this anymore, there are people from the hospital that are going to come up, and there are people from the Hospital Association and people from Dartmouth Hospital. So, and by the way, we'll talk about it again when we exec.
Yeah,
So we don't need to beat this to death.
So, Mr. Speaker, what I'll commit to is if it doesn't come up, the answer doesn't come up, the representative asks a good question about how many contracts with how many hospitals might be affected by including this in the boilerplate.
We'll hope to find that out from the Hospital Association. So,
Well, or DHHS. I'll just ask
Either
Mr.
one.
White, to tell me.
right.
Yeah.
further for the witness. Seeing none. Did you have any, Representative Murray?
Yes, I did. Thank you, Mr. Chair. If I just take a few seconds. Can you address enforcement, though? Because I'm hearing about if there's a violation, and I'm just curious, if there's a violation, do all these contracts disappear? Or do we say, well, you'll have, they'll be gone, they'll be good until the next year, and then you're not going to get them? What if there's a violation and the violation is corrected? I'm a little concerned about enforcement, and is there a bill that's going to say, oh, violation, contracts are null and void?
Well, keep in mind that the hope and the intent is just to stimulate the voluntary compliance that we expected when we put this in the Patient Bill of Rights into law to begin with. And what the bill says is that the DHHS shall not contract with any hospital. It doesn't have further language to say will void any contract that becomes knowing. It's a future-oriented looking thing. And my hope, my intent is that there will never be any more enforcement than just putting in there, this is part of our contract, please comply.
Further?
Yeah, just thank you. I think you sort of made my point in that since there is no enforcement, we have no idea what the fallout of this bill would be if there is a violation. So thank you.
I think I answered that. We're expecting voluntary compliance, and that as part of a contracting process, DHHS would have a language that the hospital would voluntarily sign off on, obligating them to comply with state law. That's not very. That's not a big reach to ask them to voluntarily comply with state law.
All right, seeing nothing further, we'll see if Melissa Blasek, is she in the room? Yes, she is. Welcome.
Thank you, Mr. Chair, members of the committee. I'm Melissa Blasek. I'm here representing Rebuild NH. I just wanted to give a little background to this story. I was contacted the day after Christmas by Ms. Shannon Buttermore, and sorry, I'm very short. Okay. And she was being denied a kidney transplant by Dartmouth Hitchcock Medical Center for not receiving the COVID-19 vaccine. Now, she had already complied with their other vaccine requirements, which was to get the Hep B series and the yearly influenza vaccine, but she did not want to get the COVID-19 vaccine. We notified lobbyists for Dartmouth Hitchcock and the Hospital Association about this, and really kind of got nowhere. I was one of the co-sponsors of this bill that added this section to the Patient Bill of Rights in 2022. It passed unanimously through both chambers. So 425 people were very clear what they were intending, which was that no patient be denied any medical treatment for not getting any vaccine. It was not specific to the COVID vaccine. So yes, it took an entire PR campaign to get any type of satisfaction for Ms. Buttermore. And they did remove their COVID-19 requirement for kidney transplants, and so she can move forward and get the treatment that she needs. However, this is not some isolated incident. This is their policy. And I still have not gotten satisfaction of seeing a policy out of Dartmouth Hitchcock that says that they've removed all of their vaccine requirements. And there are a lot of patients who are still being denied transplants for not getting other vaccines. Now, Ms. Buttermore was a rare breed. Not many people are fighters. And that's just a reality. Most people are not willing to file a lawsuit like she was. Most people are not willing to go public and have an entire PR campaign like she was. Most of these people are sick, and they will just go to another state and get the transplant that they need from another hospital and move on with their lives. And I don't blame them, okay? But that doesn't change the fact that the hospital has a widespread policy and that they have denied many people this care. So the question kept being asked, how many contracts, how many hospitals will this affect? Well, my hope is zero, because my hope is that every single hospital is following the Patient Bill of Rights. But when you have to fight so hard for your rights by going through an entire PR campaign, lawyering up, finding people to pay for that lawsuit, do those rights really exist? And the reality was that we really did not get a lot of satisfaction until we got the elected politicians on board, because there just wasn't enforcement enough from, in my opinion, law enforcement. And so, just last week, the Executive Council tabled a Dartmouth contract because they still have not gotten full satisfaction that they are in full compliance with the law. And so I think what this amendment could do is once again provide a little bit more enforcement through the legislative body. That ultimately truly was what got satisfaction for Ms. Buttermore. Unfortunately, it was not law enforcement. So I want to thank Representative Edwards for pursuing this, and I'll take any questions.
Questions, Ms. Blazik? Seeing none, thank you for your testimony and your
Thank you.
championship. Okay, now we get a chance for Dartmouth to respond. Matthew Hood is here from Dartmouth Health. Thank you for coming.
Thank you, Mr. Chairman. Members of the committee, for the record, my name is Matthew Hood, Vice President of Government Relations at Dartmouth Health. And I am here, obviously, to speak to the questions and some of the concerns that the amendment raises from our perspective. One of them, you've heard a fair amount already talk about enforcement, and nothing in the amendment would change the current enforcement mechanism, which is the sole jurisdiction is with the Superior Court. And that's a real reasonable topic for conversation about who and what agency might be the best to navigate this space. For example, the Patient Bill of Rights has a number of different provisions. Some pertain to financial matters and delegating that authority to help a patient navigate financial matters to the institution. Would that be the Attorney General's Office of Consumer Protection, for example, might be implicated in resolving that type of issue. There are issues, sorry, just gonna look at my notes for a moment. There are requirements in the Patient Bill of Rights about licensure level of the provider, but presumably the OPLC doesn't have a role in enforcement of the Bill of Rights. There are also provisions about denial of care based on age, sex, sexual orientation, race, etc. But I'm presuming that the Commission for Human Rights doesn't have a role in enforcement in this. I could go on, insurance, network plans, etc. Department of Insurance doesn't have a role. So the question that's been raised about enforcement is, if someone feels that the Patient Bill of Rights has been violated, what are they going to do? And under the bill, under the Patient Bill of Rights, even as it would be amended, they'd still have to go to the Superior Court to prove a violation. I'm not sure that that's what this body is desirous of. I think it's desirous of quicker resolution of Patient Bill of Rights violations. So that's the first piece. The second piece that I'd like to raise is the idea of individual versus facility liability. So you could have an act, I'll give a hypothetical situation. You have a new employee who's doing intake. One of the requirements, I think it's the first requirement of the Patient Bill of Rights, is that patients are given notice of their rights and responsibilities under the Patient Bill of Rights and the processes for navigating disputes thereunder. They have to be given those and sign an acknowledgement that they have been given those. Conceivably, you could see a situation where the person administers all of the information but neglects to take a signature. That's a violation of the Patient Bill of Rights. Presumably, every piece of the Patient Bill of Rights is in there for a reason and has import. But that employee wouldn't be fired. Presumably, there would be like corrective action. You'd say, here, this is what we try to do. This is what we're required to do under the Patient Bill of Rights. But there's not that type of opportunity for remedy in the situation under the current posture of the Patient Bill of Rights when there's a violation by the facility. I get agency, I get employee liability for the acts, employer liability for the acts of the employee. I just wanted to point out that one would hope that there would be a different venue and opportunity to correct alleged violations of the Patient Bill of Rights. My final question for this committee has to do with scope, and people have raised that a number of times. I can't, excuse me, I can't tell you the number of contracts that Dartmouth Health has with the state, never mind all of the facilities in the state. I'm sure we could find that out from the Department of Health and Human Services or elsewise. However, for me, pertains to what is the applicability? Is it literally everything? And so if it's contracts like we're in front of the Executive Council recently, is it contracts to provide clinical services at New Hampshire Hospital? Is it Medicaid contracts, in which case the termination of those contracts for a violation without an opportunity to address that violation would be the 36,000 Medicaid patients that Dartmouth Health serves would presumably have to go elsewhere or not get that service. And so I'm not sure that that provides the remedy that the person who is alleging a violation of the Patient Bill of Rights, I'm not sure that that provides the type of address that they would be seeking. I'll stop there. I suspect I'm happy to answer questions, so I'll suspect that I'll have that opportunity.
Representative Leishman for a question, then Representative Navalanka.
Thank you, Mr. Chairman. It's been a long time since I've seen you when you sat on the other side of the street here, but thanks for taking my question. I guess I'm a little concerned that your testimony seemed to be more worried about enforcement than following the Bill of Patient Rights. Maybe I'm wrong in that assumption, but it seems like the argument should be that the hospital will do everything they can to follow the Patient Bill of Rights.
And I appreciate the question / reiteration. Having ad-libbed it, I neglected to include that in the very opening part of my comments, which would be, we take very seriously the Patient Bill of Rights and wanting to make sure that there are violations of the Patient Bill of Rights. So I apologize for not saying that up front.
Thank you, Mr. Chairman.
Further questions?
Thank you.
Representative Navalanka.
Thank you, Mr. Chairman, and thanks for taking the question. Does Dartmouth Hitchcock have prima facie any written policies that are directly at odds with the Patient's Bill of Rights?
So there has been communication between the Attorney General's office and the Office of General Counsel at Dartmouth Health to determine whether or not there are policies in place that violate the Patient Bill of Rights. And I feel it's important to take this moment to make a distinction between a policy that required COVID vaccination in order to have a procedure, which has been reversed. That policy has been reversed, acknowledged. And a violation of the Patient Bill of Rights, which relevant section provides that a patient can't be denied services solely on the basis of vaccination status. The healthcare delivery is a fairly complex communication between patient and provider, and there could be lots of reasons why vaccinations would be encouraged, now strongly encouraged, but not required. But there could be other pieces that would impact the decision to proceed with a course of treatment or not.
Follow-up?
Yeah, a quick follow-up. I think if I heard previous testimony today, indicated that they hadn't changed the policy, they changed it with regard to COVID, which I think you've made pretty clear, but hadn't changed it with regard to other vaccines. Is that a correct?
I'd take issue with that conclusion, and I would say that our Office of General Counsel has done a fairly comprehensive review with the clinical teams and other people in the hospital to determine that there are no vaccination policies that are mandatory.
Okay.
Whether it's COVID or otherwise.
All right, thank you for that clarification.
Further questions from the committee? Seeing none. Oh, Representative Campbell.
Thank you, Mr. Chair. I have to disagree with that. I was a kidney transplant patient. I still am up at Dartmouth Hitchcock. And in order to get the kidney transplant, I had to take a multitude of vaccinations, some of which I didn't want to take, but I had to take them. So unless you've reversed that policy in the last couple of months, the statement you just made, I don't believe. Would you like to readdress that statement?
I stand by this statement, which is with respect to there was a reversal of the policy that required a COVID vaccination. a thorough review of policy has been done between our senior leadership and clinical teams that I can clearly state that there is not a policy of requirement for care for any vaccine. Do we encourage vaccines? Absolutely. Do we strongly encourage vaccines? Absolutely.
Further from the committee. Thank you for your testimony. We'll next hear from Ben Bradley, New Hampshire Hospital Association.
Thank you, Mr. Chairman and members of the committee. For the record, my name is Ben Bradley. I'm the Vice President of State Government Relations for the New Hampshire Hospital Association. We represent all 26 hospitals, acute care hospitals in New Hampshire, as well as all specialty hospitals. We do have concerns about the proposed non-germane amendment 102H, and particularly as it relates to the implementation of its intention. Excuse me. Following Matthew's comments, I would echo his comments about supporting the Patient Bill of Rights and his questions about enforcement, and wonder if enforcement should be reviewed collaboratively. It's unclear how under this bill, under this amendment, it's unclear how a violation triggers the prohibition for the department to contract. Is there an opportunity for corrective action before it gets triggered? And I guess we would question, how does prohibiting the Department of Health and Human Services from contracting with a hospital in violation of the Patient Bill of Rights help ensure that those patient rights are restored in those circumstances? Additionally, if no other entity in the state is capable of fulfilling that contract, then what happens to those services? I can't give a broad picture of all the contracts that the state has with our members, but I can tell you things like services at New Hampshire Hospital, services at Hampstead Hospital, the Doorways program that I believe 7 of our members operate and serve the communities with. All those are programs that are contracted with the state of New Hampshire. So if those contracts are eliminated and somebody isn't able to support them in some other way, if there wasn't a capability from somebody in state, would the state of New Hampshire be looking for a contract entity from out of state? And how does that contracted entity comply with New Hampshire's Patient Bill of Rights when they're an out-of-state entity that's not licensed in New Hampshire? So for these reasons, we can't support the non-germane amendment, but I'm happy to take questions as best I can. Thank you.
Questions from the committee. Representative Stringham.
So has any hospital, to your knowledge, been found of any violation of any section of RSA 15121, including any, single of that fairly long Patient Bill of Rights?
Not that I'm aware of.
Follow-up?
Follow-up.
If they were going to be found in violation, who would have done that? How would have that been brought up, and how would it be adjudicated based on current law, to your experience?
Yeah, I'm not a legal expert, so I can't really speak to that because I don't know the enforcement mechanism other than what Matthew had previously stated, which was a court process to file suit.
Representative Swiderski for a question.
Thank you, Mr. Chairman. Thank you for taking my question. So you alluded to one of my questions previously, but I just want to make sure that I'm understanding. So we heard that Dartmouth has 36,000 Medicaid patients. We know they have contracts with New Hampshire Hospital, Hampstead Hospital, et cetera. Would you say that if Dartmouth, or if any of the other hospitals that are providers in the state found that they were in violation, which would trigger, we're not sure what the enforcement would be, we were told that it's not backwards looking, but forwards looking, but let's just say a contract was nullified, would you say that that could implement a possible healthcare crisis in a region of the state based on the services that a hospital provides?
I think that's to be determined. If you look back at the applications for various contracts with the Department of Health and Human Services, I think an indicator may be how many entities actually applied for those contracts and bid for those contracts. If there was one entity that happened to be one hospital that bid for those contracts, I'd be concerned that there wasn't a backup plan. And that may be an indicator from the historic applications for those contracts, if that makes sense. So if you look back on who's bid for various contracts with the state and you see that only one entity has bid for that because that one entity is the only entity in the state of New Hampshire that is capable of meeting the expectations of that contract, it would be concerning to completely eliminate it. It may be one, I guess what I would also say is process is really what I'm questioning, is how is this determined? How is this enforced? Is there a remediation process where you could have a corrective action to prevent an entity from losing a contract with the state of New Hampshire? Now, if it's forward-looking, then I assume, which is a little bit unclear to me, but if it is forward-looking, you would assume that all contracts that currently exist are grandfathered, despite the intent here of saying you can no longer contract. So all those contracts are now grandfathered, and if there's a patient Bill of Rights violation, then this would not be triggered. So I'm just trying to make sense of how this plays out in practical reality. I understand the intention here is to hold hospitals accountable. I just wonder if there's a measured approach that doesn't prevent hospitals from serving the communities
Quick follow-up.
that need their services.
Thank you for that perspective. But looking at the language, we don't have specific language that says anything's grandfathered and it's only forward-looking or anything like that, as far as you can read.
Not that I can read. No.
Thank you.
And here's the thing. I mean, we're willing to, look at this and make sure our members are in compliance. I think the Department of Health and Human Services may provide some perspective on when they hear complaints or how this all plays out, but do have some outstanding concerns with this bill.
Thank you.
Representative Seaworth and then Representative Navalenko.
Thank you, Mr. Chairman, and thank you for your testimony.
Thank you,
Are
Representative.
you aware of, in existing contracts, is there language within them that requires compliance with state law as a condition of the contract?
It's a very good question, and I would yield to the Department of Health and Human Services as to whether that's a required expectation in their contracts and how they would handle a violation of that provision of their contracts. Thank you.
Representative Navalenko.
Nalavenko. Thank you for taking the questions. So if I understand you correctly, and I probably might agree to some extent that there are process, your focus was on process issues. So my question is, would your organization be willing to work with the committee to sort out the process questions? Really, may not be a simple matter, but most contracts, I think, contain some of the issues that were raised by Representative Murray, and those are eminently fixable. Is this something that you'd be, beyond the process questions, would be willing to work with the committee to sort out the process questions, and would that be make this acceptable?
Yeah, I'm always available to work with the committee or
Because
the legislature.
I think what it's addressed at is accountability. And I would agree that there are certain issues that are raised by other members of the committee that are process-related questions and language questions. And I'm assuming those could be sorted out in a manner that's consistent with basic contract law.
I'd be happy to share any perspective and get feedback from our membership.
Thank you.
Thank you, Representative.
Representative Priest.
Thank you, Mr. Chairman, and thank you for taking my question. I'm concerned about the unintended consequences of this amendment to the healthcare providers and those who are getting the services. And I would love to see some quick analysis of how many contracts are out there, how many people are served. What if we took a drastic approach and said, you have to live this by the letter of the law, and there are no remediation or no process on this, like we're seeing now with the Executive Council by not awarding contracts? I mean, I would like to know what the impacts are going to be to this state and to the people who are needing these services. Is that something that you could look at?
So I would just respond a couple ways. Thank you, Representative, for the question. The first is, I think as stated by others who have provided testimony, the hope is that this wouldn't have to be a measure that gets triggered. And we are committed to, our members are committed to the Patient Bill of Rights. However, we do have to look at the, as you mentioned, the consequences that are intentionally laid out in this non-germane amendment. Should those circumstances trigger a prohibition for the Department of Health and Human Services not to contract, not be allowed to contract with a hospital to provide services. With respect to my involvement in reviewing the potential impact, the hypothetical impact of this bill, I'm available and would be happy to work with the committee or anybody else. However, I also think that you could go to the source of these contracts, which is the Department of Health and Human Services, to get a full understanding and accounting of what contracts they have with hospitals licensed under RSA 151.
Thank you.
All right, I see I have a card here from somebody that deals with DHHS contracts, and maybe they can answer some of your questions if there's no further questions for this witness.
Thank you, Mr. Chair.
Thank you. So we'll call on Robert Moore. Says he's representing DHHS contracts. Thank you for coming and helping us out.
Yeah, good afternoon. For the record, Robert Moore. I'm the contracts director at the Department of Health and Human Services. First, the department's not taking a position on this bill, but I did want to attempt to answer some of the questions that came up earlier, namely around the number of contracts that the department currently has with hospitals. And this is just a rough count. We can get you a complete list of these contracts later. We have somewhere between 23 to 24 active contracts with 6 to 7 hospitals. And as referenced earlier, those include some of our psychiatric services and neurology services at New Hampshire Hospital, regional public health networks, or a wide range of services with various hospitals throughout the state.
Questions for this witness? Representative Priest.
Thank you, Mr. Chairman, and thank you for taking my questions. Of those 23, 24 contracts, how many people are being served, and how many people would lose this service if suddenly somebody claimed that you were not in compliance and therefore the contract would be void?
It really varies greatly by the contract. I don't have those numbers with me today, but we can certainly pull those numbers together.
Thank you.
Representative Rung for a question, then Representative.
Thank you, Mr. Chair. And thank you, Mr. Warren, for taking my question. I actually have two. You said that DHHS has 23 to 24 contracts with 67 hospitals.
Excuse me, 6 to 7 hospitals.
Oh, 6 to 7, I'm sorry. Okay, so I'm assuming most of the hospitals in New Hampshire don't have any contracts with DHHS, so this wouldn't impact them?
In terms of the actual, so I want to make a distinction between, Medicaid providers providing Medicaid services and then the hospitals that we're actively contracting with. So that would be a minority of the hospitals, 6 to 7 hospitals.
Oh, okay. And follow up, Mr. Chair?
Follow-up.
Are there other departments that you're aware of or other areas of the state government that provide contracts to hospitals besides DHHS?
I believe there would be other agencies that may have contracts with hospitals. Off the top of my head, I couldn't cite those, but we could look into that as well.
Okay, thank you.
Yeah.
Representative Munns for a question.
Thank you, Mr. Chair, and thank you for taking my question.
those 23 or 24 contracts that you mentioned, do they have language in those contracts right now that addresses that includes a requirement to be in compliance with the Patient Bill of Rights, and does it and are there enforcement mechanisms in that contract as well?
Yes, so all state contracts have what's called a Form P37. So those are standard terms and conditions of all state contracts. The Department of Health uses those. There's a provision in there that contractors are agreeing to comply with all applicable state, federal, local laws and regulations. Should a contractor be in violation with that provision, we would consider that an event of default. And there are also corrective action steps that we would take to work with the contractor to remedy that that are articulated in the contract as well.
Quick follow-up. So given that language already exists, to me, it sounds like the intent of this amendment is already addressed in the existing contracts that we have. Would that be a fair statement?
I think I would defer to this committee to make that assessment. As I said, the department's not taking a position on that, but there are requirements within all of our contracts that all contractors have to comply with state law. And there are steps outlined in those contracts that we would take to work with that contractor to remedy that. Should they not remedy those events of default within the period as required by the department, we would take steps to then potentially terminate that contract.
Further questions? Who was first here? Representative Campbell's.
Thank you, Mr. Chair. So just question, in this particular case that just occurred recently with Dartmouth Hitchcock, did HHS take any corrective action to help that patient?
As the contracts director, I wasn't involved in that. That's not within my purview. My understanding is the Department of Justice was working closely with Dartmouth to remedy that. But I could certainly take that back to the team. The focuses on that and get you those details.
Follow up?
Yes, thank you for the follow-up. So it doesn't seem like the system's working. You laid out a very nice process of how it's supposed to work when there's a violation, and HHS has those contracts. Why wasn't HHS involved before you had to go to the Department of Justice?
I can't speak to DHHS's involvement because that's not within the purview of the Contracts Bureau in terms of what steps or what involvement the department had up to that point.
Representative Tulerski for a
Thank you,
question.
Mr. Chairman. Thank you for taking my question. You spoke specifically about 6 to 7 hospitals that currently have contracts with the state.
That's correct.
But previously in this hearing, we were discussing, and it was referred to the fact that every hospital that takes Medicaid patients have a contract with the state. So based on that information, I'm trying to figure out how this amendment, the language of this amendment actually applies. If you believe that this would apply to every single hospital that takes Medicaid patients, or do you think that it's written to just mean an additional contract that a hospital has with the state, perhaps Hampstead Hospital or other services?
I would take this to mean hospitals that we actively have a contract with, which are, again, a distinction made between those hospitals we contract with and then those hospitals that are Medicaid providers.
Okay.
So I would not consider those to be contractors in terms of contractors that sign, hospitals that sign our P37 contract.
Okay, that's what I thought. Thank you.
Representative Hacken Phillips.
Thank you, Mr. Chair, and thank you, Mr. Moore, for taking my question. Just to follow along the lines of my colleague's earlier question about the actual language in current existing contracts, I'm assuming that these contracts also have kind of standard waiver, notice, and acceleration clauses as well.
Can you explain a little more what you mean exactly
So
by
if
your
there is a
interpretation of
default,
that? Yeah.
if there, upon a default, that the state would have the option to waive additional notice and to accelerate, their remedies, essentially.
Yeah, there are a number of steps we can take up until one notice of the event of default, articulating what the corrective action is, the cure period in order to remedy that corrective action, all the way up to termination, should that be necessary.
Great, thank you.
Further questions? Representative Rung.
Thank you, Mr. Chair. It just came to my mind that in the language of the amendment, it says the department shall not contract with any hospital found in violation. So do you take that to mean that the department would never be able to contract with that hospital again if they were found in violation? Because it says shall not contract.
I think so. That question, that's a great question. Thank you for the question. I guess I would defer to the committee in terms of how that's being interpreted. I think that question's been raised in terms of seeking clarity on that. So I'm sort of here to monitor and better understand how the department could comply with this as written.
Thank you.
Yeah.
Anything further for the witness? Seeing none, thank you for your testimony.
Thank you.
Is there anyone else that would like to testify on this, either 519 or the proposed amendment? Seeing none. Nobody on the blue sheet. The remote people that have signed in for the House Bill 519. It doesn't say for the amendment. It says supported by 35, opposed by 3, neutral for 0. So we have some input on this. We have some input from our witnesses. And this will be again discussed next Tuesday at, time did I say, 1 o'clock?
Mr.
No,
Chairman?
10 o'clock. 10 o'clock.
Clarification, Mr. Chairman? Sorry. So this will not come to Division 3 for a more in-depth discussion?
Well, it came from Division 3.
The amendment.
The amendment, where is?
He's out.
Representative Edwards. His urgency to me before this thing was he wanted it to get to the House as soon as possible so that there would be a vote on the amendment. So the amendment basically replaces 519.
Well, we would have to it actually doesn't. So I'm just wondering if we were going to have a work session or not, but you're stating that we're not having a work session.
He didn't indicate to
I'm
me
happy to
prior
manage.
to this that he planned a work session. I told him we were having an exec session. Do you want it to be on it? Yes, I want it to get before the House as soon as possible. So that's where we sit. We will be execing tomorrow, as I said, next week. So that's when we'll have further discussion on it, I believe. It may be lengthy, but because of trying to stick with what the Division 3 chair gave me as his plan, and now he's not here to make any further comments. So with what we agreed to earlier, that's what it was.
Thank you for your attention.
Okay, so, let's see, you don't have any division chairs here to tell us anything for the rest of the week? I guess not. So I think probably Division 1 is probably going to keep meeting. Representative Priest.
Point of clarification, Mr. Chairman. Division 3 has not taken a position on the bill. We've discussed it, but we have not taken a formal position. And we have not discussed this amendment.
I agree with you, but this was I did not have the impression that this was the first time you've seen it.
It is, in fact.
I'm sorry about that. The discussions I had with the chair of Division 3 said, I want to get this to the House as soon as possible. It replaces the bill, but I'm still taking care of Waypoint within the body of the budget, which is something we've done before. And normally you'll see most of the bills that we've come before us will be retained. And then we'll do our best to endeavor to put them in the budget bill. And the people that have those bills will come before us when we make the presentation, say, hey, what happened to my bill? And we'll say, yes, it's been incorporated. And then, since we do retain them, some decision has to be made this next fall. So normally we bring all those retained bills before us, we go down the list, this has been included, this has been included, this has been included, this has been included, this was not included because we didn't agree to it, and we do away with all the bills that we've retained at that point because we've done some action with them within the budget. That's the traditional way we do it. I'm sorry that this seems to be hastened. I had thought from his discussion with me that perhaps those of you on Division 3 had had some discussion on it. I apologize, but that's so far what I've scheduled for it. If he decides to have a work session in the interim, I'll have him contact you, because we've got a week.
Can I just ask a quick clarification? So that means that it'll come to full finance without a recommendation from Division 3? That's process-wise, Mr. Ripple, or?
That is what would happen. I just briefly talked to Representative Edwards a few minutes ago. He said there will probably be a Division 3 work session on this before the full finance meeting, so I'll confirm with him and try to schedule something maybe for this Friday.
Very good. All right, so that's the latest we have.
Thank you.
So possibly be aware and be ready for something on Friday. So anything further come before us? I don't know if there's, probably Division 1 meets tomorrow. Vice Chair, does anybody know in Division 1?
No, we don't meet.
You're not meeting? All right, so we'll see everybody Thursday.
Mr. Chair, I have a question about Friday. Do we have any estimate for how long the presentation will be on Friday afternoon?
Give me the question again.
I'm just wondering about Friday afternoon with the governor. Do we have any idea or an estimate of how long
Unless
meeting will
he
go?
shared it with Mr. Ripple, he didn't share anything with me for this Friday. I've got fiscal on Friday. We'll be in this room at 11 o'clock for fiscal. And then I have down Division 1 at 1:15. Okay. Representative Edwards, we have a lot of questions about the fact that your division members would like to see a work session on this bill.
I think we can work session this bill. I didn't think this was controversial. I'm surprised that it is as controversial as it is, but rather than ask you to put it on to exec next week, I'll work with my LBA, Mr. Ripple, to do a routine scheduling so Division 3 has another work session before we bring it back. I don't know if you would want to just take it straight into an exec after Division 3 does one more work session on it or not. I think it should be ready. People will either know yes or no at that point.
Okay, Friday is available. Not this room pretty much, because, let's see what we got here.
And then it's always the calendaring issue. We're early enough to get it into the calendar.
Yes, if you wanted to hold a meeting this Friday, and so you could exec it out in full finance next week, we could try to make something work, and it would get in the calendar. The limitation on Friday is the governor does present to the full finance committee at 2:30, but we could try to do something before that.
Yep. And we're hoping to have a Republican caucus at 1 o'clock on Friday.
Okay, so the Republicans we're trying to caucus as a full committee on at 1 o'clock, right?
Correct.
So then try in the morning. The morning of the 14th? I'm looking at Division 3 people for work session.
Is that when fiscal meets? I just wanted to
Is
get
fiscal-
clarity on the process because there would not be a recommendation from our division going into the exec session on Tuesday, which is why I was asking about the work session. And since we haven't seen the final amendment.
I think that's a fair question, and I'm just trying to coordinate. Do we have a fiscal? I don't think
I
we
thought
have
Chairman-
fiscal.
Not that
Chairman-
day.
Pardon me?
That's the next week.
Okay, then,
But the governor comes here at 2:30 for the budget.
Right, but so my morning is free then.
The morning's free.
So I propose we do 10 o'clock Friday, the 14th, work session, Division 3 on the non-germane amendment.
All right, is everybody here from Division 3, or if we'll get notice of it? Because it's no time to get it in the calendar.
Representative Wallner is obviously not here, so I will text her. I can't confirm anything, but 10 a.m. on Friday is what you're suggesting.
She's the only member missing so far? Okay. I appreciate you texting her. Thank you.
Mr. Chair, can I try again to ask my question about the 2:30 meeting with the governor here in finance on Friday? Do we have an estimate for the amount of time that her office plans to present to us?
We don't.
Thank you.
And normally it's the governor will be here a short time, maybe half an hour, and then would leave the budget director here to answer questions for as long as it takes. So that's generally the way we've been doing it, and I don't know how lengthy my guess would be they'd all get tired of it in an hour and a half, so. Representative Munns.
Mr. Chair, I apologize if I missed this when I stepped away, but is there any sense of what the schedule for next week is going to look like?
So we're talking about
Monday
Monday, the 17th. That's a holiday. Tuesday was when I had the exec session scheduled, the 18th. Wednesday, I believe, Division 1 will meet on Wednesday, and the session on Thursday, the 20th. And fiscal is going to meet on Friday, the 21st, which involves some of us here, but Division 1 will meet that afternoon, 21st. Probably at 1:15, I think, is scheduled. On the 18th, the exec is at 10.
And that's full finance? That's all of us?
That's all of us. Yep, full committee. Tuesday, the 18th, 10 o'clock, full committee exec. I appreciate you all being here, and I know some of you had to run out to do a committee or a bill presentation and so on, but that's the way it goes. And, I appreciate that you all want to be very thoroughly involved in this, because this is tricky. We didn't really get any straight answers about this contract stuff, did we? Did anybody hear it? Well, we got this, we got that, maybe this, maybe that, and Jose has personal experience that he was forced to take the shot to get his treatment. So, obviously they were kind of overlooking this and also distressed by the fact that COVID, we're now hearing more and more negatives about it. And, and it's not being pushed as much as it was because they admitted it wasn't a vaccine. It did not prevent as a vaccine should. And people that are getting the boosters, I don't think it's helping much either, but.
Yes, sir. May I comment on that, sir?
Sure.
I think the health community, to include the folks at the CDC, still call it a vaccine. And I've talked to them about
They redefine
the
vaccine.
damage they've done to the word vaccine.
Yeah.
And they understand that, but they still consider it a vaccine.
Yeah, by redefining it. Further thing? I appreciate your attendance. I appreciate all your good work for the budget. We'll really get busy in the following weeks. Thank you. We are in adjournment.